Today we're going to talk about EPS, extrapyramidal symptoms or side effects caused by antipsychotics. So remember the acronym ADAPT. AD, acute dystonia, A for akathisia, P for Parkinsonism, and T for tardive dyskinesia. So to simplify it, it's movement and side effects caused by antipsychotics. Acute dystonia is that sudden muscle cramping that affects major muscle groups like the head, the neck, the back. It can affect the eyes, so this is definitely one that we need to watch out for. It can be an emergency that needs to be hospitalized. Akathisia is that inner restlessness. It may look like anxiety. They can't really sit still. They just describe it as this feeling of like inner restlessness. Parkinsonism, this is like that shuffling gait, the pill rolling movements, and then of course tardive dyskinesia, which is that the abnormal movements, especially in the face, jaw. So let's get into how EPS happens. So normally for smooth muscle movement, our brain relies on a balance of dopamine and acetylcholine. When we take an antipsychotic, remember it works by blocking dopamine in the brain. So as the dopamine is blocked, acetylcholine goes up because they have an inverse relationship. And that increase in acetylcholine and decrease in dopamine causes these abnormal movements, okay? And they're more common in first generation. So your typical antipsychotics have more dopamine blockage. So these meds right here, your Haldol, your Thorazine, your Prolixin, just to name a few, are going to be more common to cause EPS than your second generation antipsychotics. How do we treat EPS? We're going to use our anticholinergics like benztropine, however you want to say it, Cogentin. We're going to use it for this one, but not in tardive dyskinesia, okay? Benztropine can actually make tardive dyskinesia worse. For akathisia, we can use propranolol and or clonidine. Parkinsonism, we can use a dopamine agonist like amantadine. Tardive dyskinesia, usually we want to switch to an atypical. And then you have newer meds like Ingrezza and Austedo. But no Cogentin in tardive dyskinesia. And other meds that can be used, sometimes we use like Benadryl and benzos, depending on the severity.